going to start in just a couple of minutes. Good afternoon, everyone. We're going to get started. If you can find your seats. Good afternoon. Welcome to the 2025 Live Well San Diego 24th Annual Public Health Champion Awards. Today, yes, you deserve a round of applause. Thank you for taking time to be here today as we recognize the achievements of local individuals and organizations in public health, partners who share in our dedication to the mission of public health. Public Health Services would like to begin by acknowledging the indigenous peoples of all the lands that we are on today. We acknowledge the importance of the lands which we each call home. We respectfully acknowledge that we are on the traditional territory of the Kumeyaay. We offer our gratitude to the First Nations for their care for and teachings about our earth and our relations. May we honor these teachings. I'm Dr. Ankita Kadakia. I'm the Interim Public Health Officer for Public Health Services for the County of San Diego and Health and Human Services Agency. I'll be your moderator for today's event. Joining us to celebrate this year's Public Health Champions is my fellow colleague, our Public Health Director, Dr. Liz Hernandez. Liz?
Thank you, Dr. Kadakia, and good afternoon. It's so wonderful to feel the energy in this room. As Dr. Kadakia said, my name is Dr. Liz Hernandez. I'm the Director of Public Health Services for the County of San Diego Health and Human Services Agency. Again, thank you for joining us in celebrating our 24th Live Well San Diego Public Health Champions Awards ceremony. After more than 2 decades of recognizing the achievements of local individuals and organizations, I'm proud to share that we have celebrated nearly 500 public health champions to date. Let me say that again, 500. And through our collective efforts, we have educated policymakers, public health professionals, and the public on important issues to improve the health of the local population. Today, we celebrate you, 14 more public health champions, to appreciate your unique efforts and achievements in building a healthier San Diego. And as we pass the torch to recognize these individuals and organizations, let us also continue to amplify the voices of our communities to protect and promote the health of the diverse populations of San Diego County, proven by our nearly 500 recognized public health champions. Each one of your voices has the power to inspire positive change. Again, thank you, and allow me to welcome back Dr. Kadakia to proceed with the ceremony opening. Thank you again.
Thank you, Liz. Before we get started, a couple of housekeeping items. I'd like to invite everyone to please silence your cell phones. Bathrooms are located near the stairwells at either end of the hallway and near the elevator. No food or drinks are allowed in the board chambers room. I'm sorry for that. If you need to use the lactation room, please see one of our staff and they'll be able to direct you. The next item is very important for our awardees. Once your name is called, you will be escorted by our county staff here to the front, the center chamber area. Here you'll receive your award, your Public Health Champion certificate, and Public Health Champion pin. Pictures will be taken while your biography is being read, and you're welcome to invite your guest during the biography reading to join you in your photos. As you know by now, this signature event occurs during and in celebration of the American Public Health Association National Public Health Week, held during the first week of April, this week, April 7th through 13th. Public Health Services is very pleased to celebrate local efforts towards this year's theme. It starts here. This theme focuses on how public health starts here, in the places we live, work, and play. From strong relationships to safe communities, public health is about creating a foundation for healthier lives. Feeling connected and supported by our community is where public health begins. National Public Health Week 2025 promotes how our communities flourish when we are together, where we can build a vision for the future, healthier, more equitable communities where everyone has a chance to thrive. I would like to share each of this year's 5 priority areas. They are also posted on our Public Health Champion webpage and provided program with additional resources about these areas. The first priority area is, it starts here. Your health is our mission. Public health isn't just for a single person, it's for you, your friends, your family, and everyone in your community. Public health affects how we all live, work, and play. It's an invisible force that protects our safety and our well-being. Public health continues to prioritize health at every level, ensuring that everyone has the opportunity to thrive. The second priority area is climate action starts here. Championing resilience for health. Climate change impacts both physical and mental health through rising temperatures, poor air quality, extreme weather events, and disrupted ecosystems. These effects are felt most in communities of color and low-income neighborhoods, which have faced years of underinvestment and systemic inequities, making them more vulnerable to climate risk. However, there is hope and a clear path forward. By taking bold and equitable action, we can reduce the health effects of climate change and build stronger, healthier communities together. The third priority area is health equity starts here, optimizing health for all. Health equity is important because it means that all individuals have access to the resources and opportunities needed to achieve their full health potential, regardless of socioeconomic, racial, geographic, or disability-related disparities. By addressing the root causes of health inequities, such as discrimination, unequal access to care, and barriers faced by individuals with disabilities, communities can reduce preventable diseases and improve overall well-being. Promoting health equity fosters healthier populations, reduces healthcare cost, and builds more resilient societies. The fourth priority area is advocacy starts here, amplifying voices for public health. Public health advocacy is about using your voice to create a healthier world for everyone. Advocates have helped create big changes in public health. Because of them, we now have laws that make us wear seatbelts in cars, vaccines that stop us from getting sick, food labels that tell us what we're eating, and rules that keep smoke out of public places. These wins show how using our voices can make life better and safer for everyone. The fifth priority area is the future of public health starts here, strengthening the public health workforce. A strong and resilient public health workforce is key to keeping communities healthy and addressing the nation's most urgent health challenges. Public health professionals work hard to prevent disease, promote wellness, and protect communities. Let's continue these efforts and move to ensure that public health systems are equipped to meet everyday health needs and respond to crises. Needless to say, there is a role for everyone in making our region healthier and safer. Everyone can have a hand to advocate for stronger, healthier, and more inclusive communities. It starts here, and we can all make a difference. These key priority areas are components of the 10 essential services of public health. As an accredited health department since May of 2016 and reaccredited by the Public Health Accreditation Board on August 21st, 2023, Public Health Services values the relationships with the many partners to promote health and wellness, prevent disease and disability, and protect the public's health. It goes without saying that the priority areas are embodied by Live Well San Diego, a long-term vision to build a healthy, safe, and thriving region. I would also like to personally thank everybody here today, and especially all of the awardees, for your commitment and leadership in forging together a healthier San Diego County, which helps to build a healthier America and a healthier world. Now I'd like to introduce our County Health and Human Services Agency Director, Dr. Kim Giardina, who will provide welcoming remarks.
Thank you, Dr. Kadakia. And first, let me just start by acknowledging both Dr. Kadakia and Dr. Hernandez, our fearless leaders of our County Public Health Department. We could not do what we do without both of you, and just want to thank you both tremendously and your entire team for all the work that we do to keep our communities safe and healthy. So thank you so much. Well, I am truly excited to be here with all of you. As Dr. Kadakia said, I'm Dr. Kimberly Giardina, the Deputy Chief Administrative Officer for the Health and Human Services Agency, and it's really my honor to help celebrate our 24th Public Health Champions Awards. This is my first Public Health Champion Awards ceremony as our agency director, but I really could not be more excited and more impressed by the work that happens every day. At HHSA, we know that our purpose is to advance opportunities for all San Diegans to live well. And as you've heard so far already, we do not do that alone. It truly takes an entire community for us to support all of our residents of San Diego, and all of you are critical pieces of the work that happens to make sure that our residents are safe, healthy, and thriving. And so thank you so much for the dedication and the work that you all put in. As you heard, our theme, it starts here. And so it is truly critical that we continue the collaboration and learning from our community leaders and all of you. The future of public health is at a crossroads right now. I think we're all seeing the change and what's happening across our country. So it's more important than ever that we continue to work together and celebrate our collective work. Today is a very special day. I can't think of a better way to have a Friday than to kick off something like this and getting to recognize our 14 incredible community leaders that we are constantly learning from. And the awardees are individuals and organizations who go above and beyond in their commitment to public health. As many of you know, we've been driven by our Live Well San Diego vision for over 15 years now. It is a vision of healthy, safe, and thriving communities, and it's helped guide our efforts through strategic approaches and focused areas of influence. Since the inception of the vision, we have made great strides in reducing deaths caused by preventable chronic diseases. Since 2007, there has been a 13-point decrease in the proportion of deaths associated with chronic deaths. That is huge, and thanks to all of you. It means that less people are dying from heart disease and stroke, cancer, type 2 diabetes, and lung disease. And there are countless other examples of how Live Well partners have worked together to improve the lives of our community members. And many of you are part of our Live Well San Diego collective impact team. It's about individuals, governments, businesses, nonprofits, all of us working together. And as of today, we are really close to having almost 600 Live Well San Diego official partners, which is pretty incredible when we started with one. And so this vision involves partners from all of our sectors. We have other cities and governments, businesses and media, schools, education, community, and faith-based organizations. And that's because, as Dr. Kadakia highlighted, we need public health in every aspect of our lives, right? It is across all sectors of what we do. And so we are really proud to recognize the awardees today that represent so many different aspects of what it means for us to have good public health. I also just want to say, as I look around the room this afternoon, it is wonderful to see so many smiling faces who are here, of those of you who have dedicated to help so many people live well. I'm really grateful that each of you has taken the time to be here this afternoon, but more so for the work that you all do every single day. I really do hope our partnership continues to grow and thrive, even as we face times of challenge ahead. Personally, I think those are opportunities where we can flourish even more in terms of collaboration and partnership. So thank you for all that you do. I am going to give a little caveat. I am going to apologize in advance because amidst all the many changes, you might be aware, keep happening on a daily basis right now. I'm gonna have to step out a little early today, which was not my intention, and so I apologize for that, but I didn't want it to seem weird when I get up and walk out. It's not anything anybody did, I just apologize. We have some things I'm gonna have to take care of in a little bit, so. So with that, again, thank you all so much, and I'm gonna turn it back over to Dr. Kadakia.
Okay, thank you, Kim, for that. Okay, here we go. I'd like to take a moment for all of our public health champions, guests, and fellows to please stand and move towards the podium for a group photo. Did I get that right? Yes. So we're gonna have, I'm gonna say it again, our public health champions, our guest, and our fellow leaders to please move towards me, I don't bite, and we're gonna take a photo, a group photo, because we know you're gonna be all excited and going off to enjoy your awards and our reception. Yes, perfect. Yes. We can, yeah.
Oh, to the back. Okay.
I was okay. And all these people? Okay, I trust you. I trust you.
I didn't see the email until just now. Yeah. Equally.
Come forward.
That's, oh my God. How did that happen?
We would like for nice people to.
How many grant packages? I guess they
We'll go up here. Sorry, I'm gonna go up in my room.
picture too.
Not trying to get
Oh, yeah, there's the.
just look at his face. He'll catch everything in the middle. I would yell at Mark.
Terrible.
All right, 1, 2, 3.
Got some good squats in.
Oh, yeah. Here, I have no hand.
Back to back to the. Oh, that was nice of you.
All right, thank you everyone for coming up to take that photo. I think that might have been a public health miracle that we just witnessed. All right, so we're going to get started again. At this time, I'd like to explain the Public Health Champion Awards. I know it's 14 of your first times here and many of you joining us today. These awards include the Director's Award, the Public Health Services Wilma J. Wooten Theme, Individual and Organization Awards, and the Aging and Independent Services, Medical Care Services, and Regional Awards. All awards presented here today honor an individual or an organization in San Diego County for outstanding contributions in the prevention of disease or injury and the promotion of public health. The Director's Award honors individuals or organizations for their outstanding contributions to public health by collaborating with the Health and Human Services Agency through a common agenda, shared performance outcomes, mutual missions and goals, and with open and transparent communications, all components of collective impact. Last year, Wilma J. Wooten retired after 14 years as our county public health officer and more than 20 years of service to the community. with an international recognition as a leader in the realm of public health. Dr. Wooten was instrumental in developing a groundbreaking health equity framework in 2010 for local health departments to integrate equity into their organizations, which support the principles of national public health accreditation process, and implementing the first Public Health Champion Award ceremony held in 2002 during a Board of Supervisors meetings. During her tenure, Dr. Wooten had led numerous public health initiatives, including perinatal equity, opiate use, tuberculosis, hepatitis C, and most notably, her critical role in navigating the ever-changing dynamics of the COVID-19 pandemic. For these reasons and many more, the following awards for theme, individual, and organization are officially renamed as the Wilma J. Wooten Theme, Individual, and Organization Awards. Yes, that deserves applause. The Wilma J. Wooten Theme Award honors an individual or organization who has demonstrated outstanding contributions in the area related to the theme of the annual National Public Health Week. The 2025 Theme Award winner should exemplify achievements in public health that have promoted a healthy nation and created a ripple effect throughout San Diego County. The Theme Award recipient recognizes that our health begins at home and in the community because public health is all of us, and it starts here. The Wilma J. Wooten Individual Award honors an individual who has made outstanding contributions by taking health into action while promoting a healthy nation in San Diego County. As well, the Wilma J. Wooten Organizational Award honors a community organization that has made similar significant contributions in San Diego County communities. Next, nominations for the Aging and Independent Services, Medical Care Services, and Regional Awards are presented by a director or representative of the HHSA, AIS, and MCS departments, and the director or representative of the Office of Strategy and Community Engagement, overseeing the 6 HHSA regions. These awards also acknowledge individuals or organizations that have made outstanding contributions to the prevention of disease, injury, and/or promotion of health in their targeted areas. They're restricted to individuals or organizations that have a working relationship with AIS, MCS, or one of the 6 HHSA regions. To further acknowledge the recipients and their contributions, the names of this year's awardees will be permanently displayed on the Public Health Champion plaque, along with all the awardees who've received these awards in the past. You'll soon hear how these deserving awardees protect and promote the health of our communities and as a nation as a whole. Now let's begin our award ceremony, and starting with Director's Award. Please welcome Dr. Kim Giardino.
Thank you again, Dr. Kadakia. It is really my great honor to get to present the Director's Award. And this year, it recognizes 2 extraordinary organizations that collaborate with our County of San Diego to ensure our vision of Live Well. I want to call them up one by one, and I'm going to share a little bit about their achievements that has led them to become the recipients of our 2025 Live Well San Diego 24th Public Health Champion HHSA Directors Awardees. So it is my pleasure to first announce Sharia's Closet. I'd like to invite Shameen Linden and any guests to join us. Thank you so much for being here and for the work that you do. I'll share a little personal anecdote. I shared earlier, my background is as a social worker in child welfare, and what Shameen probably didn't know is that she has helped a number of families directly that I have worked with in my prior role, that I've been able to refer to get help from Sharia's Closet. And so it has just been a real honor to get to recognize the work that you and your entire team have been doing. We really appreciate it. Established in 2013, Sharia's Closet was built to empower community members by promoting self-esteem and self-identity through the provision of clean, gently used clothing and hygiene products. By providing free emergency clothing to individuals and families experiencing financial hardship or crisis, they have helped victims of natural disasters, human trafficking, domestic violence, refugees, and those who were unemployed, injured, disabled, or experiencing homelessness. To be entrusted with our most vulnerable members of the community impacted by heartbreaking circumstances takes resilience and immeasurable strength to stay strong for those who need it most. As simple as it sounds, the saying, "look good, feel better," means more than just the clothing. These are the closest things to our bodies that we wear on a daily basis to convey a narrative about our identity to the outside world. Fashion is a powerful tool that goes beyond aesthetics. It is a language, an influencer, and what represents who you are and who you want to be. Sharia's Closet knows this all too well. Over the years, they've achieved significant milestones in supporting the community. By 2023, they had served nearly 50,000 individuals, helping them build self-esteem and empowering them to succeed in various aspects of life. Through these initiatives and services, Sharia's Closet continues to address critical needs in the community, aligning with public health objectives by promoting well-being and dignity among vulnerable populations. Their accomplishments have, without a doubt, made San Diego a more healthy, safe, and thriving region. Congratulations and thank you. Where do you want us? Back that way?
Would her guests like to join us?
One, two, three. Beautiful, thank you.
Okay, so did you know that Americans live an average of 35 years longer today than they did about 150 years ago? That is pretty impressive progress, thanks to our public health efforts to improve the well-being of communities across our nation and around the world. Our next recipient is at the forefront of this incredible progress to ensure that older adults and adults living with disabilities can continue to thrive, even as they grow wiser each year. Please join me in welcoming Perla Hurtado and her guests to the podium. Yes, thank you. So I want to thank the Foundation for Senior Care for being a very active member and close partner with our Aging and Independent Services team. Since 1979, your commitment to support physical and mental well-being of the community with a focus on older adults and adults living with disabilities in rural San Diego has helped countless San Diego residents to live well. For more than 40 years, the Foundation has helped to establish appropriate care plans and social support systems to prevent hospital readmissions. Examples of care services include the Adult Day Center, the Club, which provides caregiving and social interaction for older adults with cognitive and physical challenges. A hospital-to-home recovery support program that helps older adults before, during, and after hospitalization to ensure a safe and full recovery. And the Foundation's donation-based senior and disabled transportation program that provides more than 5,000 rides annually to older adults 60 and older and adults 18 and older living with disabilities in the greater Fallbrook area. Just like their physical care services, their social services are also passionate about continuous optimal care for older adults. Notable services include monthly caregiver support groups to provide education, resources, home care guidance, future planning, and strategies for respite and self-care, and weekly classes, including Fix It Friday sessions, where individuals can receive personalized assistance from instructors with expertise in Apple, Android, and Windows systems. The next time my mom calls me, I know where to send her. As you have heard, it is clear that the foundation is passionate about serving older adults and has proven their commitment to the Live Well San Diego vision for a region that is building better health, living safely, and thriving. Congratulations, and thank you so much for all the work that you have done.
One, two, three. Another one, one, two, three. One, two, three. Well, thank you.
I think it was you, Canada. So congratulations again to all the recipients of the 2025 Live Well San Diego Public Health Champions HHSA Directors Awards. Yes, that does deserve extra applause. I'd like to now welcome Alicia Espinoza, Public Health Services Office of Border Health Chief, to begin the Public Health Services Public Health Champion Awards.
Thank you, Dr. Kadakia. I also have a personal anecdote, and so thank you all for joining me here today. I have the honor to recognize this year's Wilma J. Wooten Public Health Champion Theme Award, and so please join me in welcoming April Fernandez and any guests to come up to the podium as I present just a few of April's many highlights and achievements. If you heard me whisper, I said I'm going to try not to cry. Let's turn the page. April's lifelong dedication to improve the health of local and binational communities is not an understatement. For more than 30 years, April has positively impacted communities through her exceptional public health management experience and commitment to various roles to increase accessibility to health services. From 2011, Ms. April Fernandez has co-chaired the San Diego and Imperial Counties Border Health Collaborative and served as the chief of the Office of Binational Border Health in the California Department of Public Health. Not only co-chaired, but helped to initiate the collaborative. And during her tenure, April led and addressed the unique health challenges of border populations and served as a driving force to advance cross-border health initiatives. During the formation of the Border Health Consortium of the Californias, a binational entity established to address health concerns specific to the border region, April played a pivotal role in collaborations between multiple public health agencies, nonprofits, academia, and local communities. Under her leadership, April facilitated cooperation between health officials, health professionals in California and Mexico to reduce the risk of disease in the California border region. Ms. Fernandez is not limited to cross-border efforts. She has also served on the board of the Alzheimer's Association for San Diego and Imperial Chapter to add value, expertise, and support individuals and families of those affected by Alzheimer's disease. Although Alzheimer's can feel like an impossible disease, April strongly believes that people can still live well after a diagnosis. Through supportive services, education, social connection, and community awareness, April's advocacy has enhanced the quality of life of all of those affected by dementia in San Diego County. Lastly, Ms. Fernandez's service on the board of Maná de San Diego, a nonprofit organization dedicated to empowering Latinas, has allowed diverse perspectives for strategic direction and ensured all members' voices were heard and valued at every step. Through a collaborative leadership model, Maná de San Diego uplifts women and families living in San Diego and Mexico regions through education, leadership development, community service, to champion mentorship and advocacy opportunities to thrive. Currently, April serves as the chief of CDPH Office of Binational Border Health, where she has established policy and direction to protect the health of residents along the California-Baja California region. In this role, Ms. Fernandez coordinates and oversees the Border Health Status Report, a comprehensive technical report regularly delivered to state legislature that serves as a critical reference for public health programs and services for non-government and community-based organizations. It is without a doubt that April's exemplary commitment has created lasting and impactful changes across counties and borders, and I've had the great pleasure of seeing and witnessing her work. And I am proud to recognize April Fernandez as the Wilma J. Wooten Theme category recipient of the 2025 Live Well San Diego 24th Annual Public Health Champion Award. Congratulations, April.
One, two, three. Perfect, thank you.
And now I'd like to welcome Denise Lazares, Director of Nursing, to introduce the next award recipient.
Thank you, Dr. Kadakia. So I have the honor to present the first of two recipients for the Wilma J. Wooten Individual Public Health Champion Award. I would like to invite Veronica Ronnie Whitehorse and any guest to come up as I read your acknowledgements. Who would like to hold this? So for the past 20 years, Ronnie has been a trusted healer, educator, and leader at the San Diego American Indian Health Center. Ronnie's commitment to public health, disease prevention, and community wellness is profoundly personal. She does not simply serve patients, she advocates for her people. Her presence ensures that healthcare is not a foreign, impersonal system, but a safe and welcoming space where cultural identity is respected and honored. As an Indigenous nurse and advocate, she embodies the essence of culturally competent care, ensuring patients not only receive medical attention, but also are seen, heard, and valued in their traditions, identities, and lived experiences. Her work extends far beyond the walls of a clinic. She builds relationships, she instills hope, and guides patients through healthcare challenges, and with an understanding that can only come from someone who shares their cultural roots. Her work is not just about treating illness, but about healing communities, physically, emotionally, spiritually. Ronnie is more than a healthcare professional. She is a lifeline to the American Indian and Alaska Native community in San Diego County. For these efforts, I am pleased to announce Ronnie Whitehorse as the individual category recipient of the 2025 Live Well San Diego 24th Annual Public Health Champion Award. And now, we'll move over.
One, two, three. Okay. Thank you.
And now I would like to ask Adrienne Yancey, Assistant Public Health Director, to present the next individual award recipient.
Thank you, Denise, and good afternoon, everyone. I have the honor to present the second Wilma J. Wooten Individual Public Health Champion Award, and I would like to invite Dr. Antoinette Marengo to please come down with her guests so we can read your acknowledgments. For several years, Dr. Marengo has been a champion of health equity with a long track record of advancing public health in San Diego County. A board-certified physician for 20 years, she set the vision and upholds the quality of reproductive health care services for 19 health centers across San Diego, Riverside, and Imperial counties. From 2010 to 2018, Dr. Marengo served as the staff OBGYN at the Navy Medical Center San Diego, the U.S. Navy's largest West Coast hospital. She was selected as the first civilian associate residency program director in the history of the department, where she developed the complex family planning curriculum for the residency program. Gender-affirming care expanded from 800 in 2021 to more than 3,300 in 2024 under her leadership. She ensured staff were well-trained to support gender-affirming care and prioritize in-center and telehealth services to help people in rural areas access care, including legal assistance to change their name. Most recently, for those diagnosed with HIV, Dr. Marengo's leadership strengthened collaborative partnerships to help launch a new program to provide immediate treatment. This new program supplements a long-term program that provides a warm handoff to partner healthcare organizations and offers assistance when finding other forms of community support through care coordination programs. Currently, Dr. Marengo is a volunteer professor of OBGYN at UC San Diego Health Sciences. She is also part of UC San Diego Health Sciences medical recruitment team. Is the chair for the American College of OBGYNs and a member of the Committee on Advancing Equity in Obstetrics and Gynecological Care. I knew I was going to mess that word up. That's why I've been saying OBGYN. For these efforts and many more, I'm pleased to announce Dr. Marengo as the individual category recipient of the 2025 Live Well San Diego Public Health Champion Award. Congratulations.
One, two, three. Thank you.
And now I would like to welcome up Dr. Anuj Bhatia to present the next award.
All right. Thank you, Adrian. Okay. I'm sorry. Sit. Okay. Thank you. Sorry. I'm honored to present for this year's Wilma J. Wooten Public Health Champion Organization Award. I would like to invite Dr. Margaret Ryan, Regional Medical Director at the Defense Health Agency, DHA, Immunization Healthcare Division, Pacific Region Team, and guests to join me at the podium. The U.S. military established the Defense Health Agency, DHA, Immunization Healthcare Division, Pacific Region Team in San Diego 10 years ago. Since inception, the Pacific Region Team coordinates all military-related immunization care in the Pacific region, with a special focus on care to military residents and visitors in the San Diego region. More than 20,000 vaccines are administered every month among more than 40 local military immunization clinics. Immunizations provided to military beneficiaries in San Diego include all vaccines in the routine childhood and adult schedules, international travel, vaccines to unique military operations, and more. In addition, the Pacific Region Team provides continuing education and training and on-site clinical assessments to ensure best practices for immunization care. The clinicians who serve on the DHA Immunization Healthcare Division are proud to be a part of a 24/7 support center, taking on-call responsibility to respond to immunization consults from U.S. military providers and patients worldwide. This award serves as a reflection of this organization's ongoing commitment to provide public health in our community. You truly embody the vision of Live Well San Diego. And so, for all efforts mentioned, I am honored to announce the DHA Immunization Healthcare Division Pacific Region Team as the 2025 Live Well San Diego 24th Annual Public Health Champion Organization Award recipient. Hi. We'll now pose for a photo. Close up. Okay, 1, 2, 3. Thank you.
Thank you so much.
Now, I would like to ask Jennifer Bransford-Kuhn, Director for Aging and Independent Services, to present the Aging and Independent Services Public Health Champion Award.
afternoon. I'm excited and honored to recognize Amy Abrams as our Aging and Independent Services Public Health Champion. And I'd like Amy and her guests to come forward. Driven by a passion for aging, community health, and social services, Amy Abrams has spent her 28-year career dedicated to serving and advocating for older adults and persons living with disabilities in San Diego County. She co-founded Windward Life Care, a home health agency, and served as their vice president of client services supporting people living with chronic conditions and their caregivers. For 7 years, she directed the education and community outreach programs for Alzheimer's San Diego, which is where I met Amy. Currently, Ms. Abrams leads several impactful community initiatives and has created many innovative programs through her work with the Grossmont Healthcare District as the Chief Community Health Officer. She established a mobile outreach library to increase community access to books and resources related to health and wellness. She also organized Health Literacy Day, which included educational sessions and a community fair. Ms. Abrams coordinated an educational program titled Emergency Medical Services, What You Need to Know, to help San Diego County residents better understand emergency medical services. To improve access to care, Ms. Abrams has also facilitated meetings between the East County's Arabic-speaking immigrant community, key community stakeholders, and the local healthcare system. To promote better skin health, she introduced public sunscreen dispensers program in the city of Santee. I really need that. That should be everywhere. Ms. Abrams started a memory cafe to support persons living with dementia and their families, as well as end-of-life death literacy series to assist families with end-of-life care decisions. Currently, she is working with 911 dispatch, hospitals, and local care facilities to develop new decision support protocols. These protocols will focus on reducing unnecessary emergency room visits for older adults and those living with cognitive impairments. Ms. Abrams has worked closely with Aging and Independent Services for many years, supporting initiatives such as the Alzheimer's Project and Age Well San Diego. Over the past year, Ms. Abrams has been a key partner on several AIS community efforts, including the Community Action Networks, Age Well Dementia and Brain Health Team, and the Scam and Fraud Education Support Team, or SAFEST. Ms. Abrams, in collaboration with the San Diego East Community Action Network, successfully hosted the first Dementia Skills and Resource Fair at Grossmont Healthcare District's Conference Center. This event focused on improving care for persons living with dementia in San Diego County. Ms. Abrams' support and coordination, with Ms. Abrams' support and coordination, SAFEST plans to start its first in-person pilot support program for scam and fraud victims at Grossmont Healthcare District's Health and Wellness Library in the summer of 2025. In addition to AIS initiatives, under Ms. Abrams' leadership, the Grossmont Healthcare District's Health and Wellness Library has become a hub for several county initiatives, including Love Your Heart, Check Your Mood, and Fall Prevention Awareness Week. Ms. Abrams' overall work with the Grossmont Healthcare District is an excellent example of why she is a public health champion. She consistently brings together community partners, local organizations, and government agencies to address public health issues and improve community outcomes. Her collaboration with Aging and Independent Services and other county departments has played an integral role in implementing various impactful programs focused on supporting the health and well-being of older adults in San Diego County. for her many accomplishments, her leadership, her passion, her commitment to supporting the health and well-being of older adults and persons living with disabilities in San Diego County. I am very proud to present Amy Abrams with the Aging and Independent Services 2025 Live Well San Diego 24th Annual Public Health Champion Award.
Okay, 1, 2, 3. Thank you.
Now I'd like to invite Jamie Beam, the Director from Medical Care Services, and Dr. Jennifer Tudor.
You're so nice. Thank you. Isn't it awesome to be here today celebrating our loved ones and our colleagues? This is just what a great environment here and learning about what so many in our community do. So hi, as Jennifer said, I'm Jennifer Tudor. I serve as the Chief Medical Officer here at the County Health and Human Services. I'm here with Jamie Beam, who is our Director of Medical Care Services. And I'm also here with Dr. Phaedra White, who is our Chief Dental Officer. Could you guys hear that creaking back there? Yeah, I did. So we would like to invite Sarah St. John to the podium, please, and all of her guests and loved ones. I just have to say, her guests and loved ones, both of whom are named Matt, right? So very great. So Sarah is the founder of All Smiles Sarah St. John LLC, which is a portable preventive dental hygiene service dedicated to reaching our underserved communities. Sarah also leads Project All Smiles, Inc., which is a nonprofit organization focused on expanding access to dental hygiene services and training individuals in need. Channeling her passion for addressing dental disparities through these efforts, Sarah provides essential oral health care at schools, to individuals experiencing homelessness, and to those with limited access to traditional dental care, including military spouses. Sarah's groundbreaking work includes spearheading San Diego County's first school-based dental sealant program in 2019, which is now operating in partnership with 3 school districts in San Diego County. This innovative program provides no-cost services to school children, including dental screenings. This is a long list, ready? Dental screenings, cleanings, fluoride treatment, dental sealants, education, and referrals to specialty care as needed. Sarah's work ensures many children in our community receive an annual dental cleaning, which is a benefit of Medi-Cal Dental. And now I'm going to turn it over to Jamie and raise the mic because she's taller.
I was going to say, but wait, there's more. Right? Sarah is now venturing into new territory by collaborating with health service providers to offer in-home dental hygiene care for older adults and individuals who are disabled and or unhoused. Through the county's street medicine initiative, Sarah's connected with providers to start offering services at homeless court pop-up resource fairs. Her dedication to community service, innovation in mobile dentistry, and commitment to empowering others have made a lasting impact in the field of oral health care. These are just a few examples of Sarah's accomplishments, her dedication to reducing health disparities, and her ongoing commitment to the community. We are honored to present the 2025 Live Well San Diego 24th Annual Public Health Champions Award for Medical Care Services to Sarah St. John. Thank you. Now let's take a pic. Oops, sorry. Thank you.
One, two, three. 1, 2, 3. Okay, thank you.
Okay. Together. No. And now I'd like to invite Rosa Gracian to come up and present the regional awards.
Back down. There we go. Hi, everyone. Good afternoon. It is my honor to be here today. My name is Rosa Graciana. I'm the Deputy Director in the Department of Strategy and Community Engagement. And I am here today to celebrate several individuals and organizations who have dedicated their efforts to making each of their regions healthy, safe, and thriving. I will be presenting the Regional Public Health Champions Awards today. These 6 awardees stood out as exceptional organizations and individuals who are making and working towards a more equitable San Diego County. As mentioned earlier, the theme of this year is Public Health Week. It starts here, and all 6 regional awardees do just that. They make it their mission to celebrate individual cultures and strive for equity, diversity, and more importantly, inclusion. This is why they were chosen, and that's why we honor them today. I'm happy to kick us off with South Region, so I'm going to ask Karen Clay and her guests to make her way forward. Really is. All right. To begin recognizing the amazing organizations and individuals, we start with Karen Clay, president and founder of I Love to Glean, a nonprofit dedicated to food recovery and distribution, who has been a leader in addressing food insecurity since 2013. Known for her collaborative approach to her work, Karen often volunteers to assist other new feeding organizations in navigating the intricacies of different food systems. She partners with multiple food generators, food recovery distribution organizations, and kitchens to strengthen the local region's capacity to recover and redistribute edible food to hungry residents. She has been instrumental in supporting the incorporation of harvest crops and served as the general manager of Senior Gleaners, consistently championing food access and recovery initiatives. Karen has received and distributed over 3.8 million pounds of nourishing food and has prepared and delivered over 111,000 meals since the startup. Karen helped distribute approximately 110,000 pounds of USDA farm to families boxes and coordinated the weekly planting, distribution, and delivery of 600 fresh fish meals through the Fish to Families program. She currently serves as co-chair for the Promise Zone Healthy Communities Working Group for the Live Well San Diego South Region Community Leadership Team Food Insecurity Work Group and facilitates the San Diego Promise Zone Nourishment Network for Hunger Relief meetings.
Wow, she's not busy at all. She is also currently leading efforts for the establishment of a cold food hub in the South region. Today, we are honored to award Karen Clade as the South Region Public Health Champion in 2025. Congratulations.
One, two, three. One, two, three.
Thank you. And I'm going to warn you now, I have 5 more to go, so you get to hear me a little bit longer. All right, our next awardee is we're recognizing in the Central Region Fern Street Community Arts. So I'm going to ask them to make their way to the front. So as we moved on to Central Region, we recognize Fern Street Community Arts, also known as Fern Street Circus, which is a transformative organization that serves families and enriches neighborhoods through the performance and teachings of circus arts. With a mission to break cultural and linguistic barriers, the organization brings together professional artists and community members to co-create circus performance in local settings. Beyond regular classes, Fern Street Circus designs tailored programs for schools and community organizations. These initiatives integrate circus skills with elements like literacy and nutrition, addressing broader educational goals. By merging the physicality of circus with theatrical skills, Fern Street Circus fosters social change and strengthens communities through collaborative art. The organization has also been recognized as Cirque du Soleil's social action partner in San Diego, highlighting its commitment to fostering community development through the arts. Their vision emphasizes the power of circus to unite diverse groups, offering a creative and supportive environment where children, teens, and families can grow, celebrate milestones, and form lasting connections. Through its inclusive and accessible programs, Fern Street Circus creates lasting positive impact in communities in need. Now, I want to just add a personal anecdote for anybody that lives in the Central Region community. If you haven't seen one of their events and you really want to see diversity and inclusion in action, this is really the place to go. And the work that they do for the community and youth is truly spectacular. So with that, now we want to congratulate Fern Street Circus as the Central Region Public Health Champion in 2025.
We have our neighborhood tour starts tomorrow.
Do you want to quick plug in?
Sure, thank you. Fern Street Circus every year plays in city parks from City Heights all the way south to San Isidro, and tomorrow is the beginning of our neighborhood tour. We will be at Park de la Cruz. Our show is at 2 o'clock. We have health fairs, and Mariachi Victoria. On Sunday, we will be at North Park. Fern Street Community Arts has a complete schedule.
Perfect.
Thank you.
All right, 1,
Yes, you came prepared. They have flyers too for anybody that's interested. All right, so now we're gonna be moving on to the East Region Champion. So I'm gonna ask David Shorey to join us up on the podium. It is, it's nice. Nice and heavy, okay. So now for our East awardee, we're congratulating David Shorey. David Shorey is a dedicated public health leader with over 30 years of nonprofit experience driving performative change in communities across California. As Director of Prevention Programs at the Institute of Public Strategies, he has spearheaded multiple regional and county-wide initiatives that have directly influenced policies, improved public health outcomes, and strengthened community resiliency. A recognized expert in leadership development, coalition building, campaign strategy, and policy advocacy, David excels at bringing people together around a shared vision. Beyond his policy work, David is a certified nonprofit professional and an expert in leadership development, coalition building, and campaign strategy. His work has mobilized diverse stakeholders, including policymakers, law enforcement, healthcare professionals, and community advocates to implement lasting evidence-based solutions. David has led significant reductions in opioid misuse and other substance-related harms through targeted education, outreach, and policy changes. David Shorey is a shining example of this year's award theme. Now we would like to take a moment to congratulate David as the East Region Public Health Champion for 2025.
One, two, three. Perfect.
Congratulations, thank you. All right, so now we are gonna go next to our North Central. Oh yes, absolutely, go right ahead. Oh, bravo. No, it's all good. It's good timing. All right, so we are gonna go next to our North Central Award for the North Central region. I'm gonna ask San Diego Military Family Collaborative and guests to please make their way up front. Divide and conquer with the awards. All right. So the San Diego Military Family Collaborative supports and strengthens the military-connected community through education, advocacy, and engagement. The San Diego Military Family Collaborative is a trusted hub for connection and collaboration, helping bridge gaps between service providers in the military-connected community. Through consistent outreach, community convenings, and research sharing initiative, SDMFC ensures military families are supported, informed, and empowered through every stage of military life.
They envision a county where all members of San Diego's military's connected community can easily gain access to and navigate critical information, programs, and resources when faced with military life. Challenges through streamlined services in a network of support. From 6 organizations in 2010, SDMFC grew by word of mouth and today comprises more than 400 representatives from over 200 unique public, private, faith-based, military, and government organizations. We are proud to celebrate San Diego Military Family Collaboratives as the North Central Region Public Health Champion for 2025. Congratulations.
One, two, three. Thank you.
Have to make sure I don't lose my page, or we're in big, big trouble. Okay. Next, we're gonna go to our North Coastal Regional Award. So I am gonna ask Gabby Love to please make her way forward with any guest.
I'll share the wealth.
Yes. Okay. Thank you. All right. All right. So Gabby Love is our North Coastal awardee, and Gabby Baez Loves is a first-generation Mexican-American, the daughter of migrant farm workers with roots in both Solano Beach and Encinitas. As the first in her family to pursue higher education, Gabby has received an AA degree from Maricosta College and was awarded the Latino Healthcare Professional Project Fellowship at California State University in Long Beach. With more than 29 years of experience working with vulnerable communities, Gabby now finds herself in her dream job, working for school relations and diversity outreach at Maricosta College, the same college where her story first began. She is always looking for opportunities to help students and their families grow. Gabby provides academic support, social services, and leadership opportunities for students and their families. She is dedicated to helping marginalized communities realize their potential, encouraging them to access higher education and discover all that is available to them via certificate and vocational programs, AA degrees, and beyond. Gabby also serves on the board of directors for the Mexican American Educational Guidance Association, La Colonia Community Foundation, Nature Collective, and Los Angelitos de Encinitas. A lot of busy people up here, huh? A lot of different committees. She has chosen to participate with these boards because of her passion for ensuring the Latinx community's representations in all aspects of San Diego County, including access to open spaces like parks and natural reserves, which are vital for community well-being and quality of life. She envisions a world where everyone experiences, connects with, and protects nature, fostering a deeper appreciation for the environment. Gabby is also committed to improving healthcare and mental well-being for disenfranchised communities, ensuring that they have the support and resources that they need to thrive. Now, I want to congratulate Gabby B. Love as this year's North Coastal Region's Public Health Champion Award. Good time. Yeah, perfect timing.
Can we have Lorena come?
Absolutely.
Come on, Lorena.
Come on, Lorena. Yeah.
All right, 1, 2, 3. 1, 2, 3.
And I just love that. I just heard that 2 of our team members in North Region were Gabby's students, and now they're here in the county continuing to help the community. So really showcasing the power of collective impact. All right, last but not least, we have our North Inland Public Health Regional Award for the North Inland region. I'm going to ask Backcountry Communities Thriving to make their way to the front. All right, so Backcountry Communities Thriving, or BCT, is a nonprofit organization with a mission to ensure the well-being of each child, family, and individual in Julian and the surrounding rural areas through advocacy, service, and support to foster a thriving community. Backcountry Communities Thriving addresses challenges for backcountry residents by partnering with many organizations to bridge the gap in services and provide support. They work hard to bring organizations from the city to Julian for presentations on Alzheimer's disease, community disaster preparedness, CPR training, fentanyl awareness, and other educational opportunities. With an ever-increasing senior population, BCT supports the senior community through social connection, luncheons, and they are working to include more activities. At Julian High School, they offer scholarships for graduating high school seniors, as well as providing financial support to athletic teams and enrichment programs. It is our honor to recognize Backcountry Communities Thriving for all of the work that they do in the North Inland regions in our much needed and hard to reach rural communities. Congratulations. Thank you.
One, two, three. 1, 2, 3. Thank you.
All right, that concludes our Regional Public Health Champions. It is now my pleasure to turn it to Dr. Liz Hernandez for some closing remarks.
Thank you, Rosa. I am just really personally moved by all of the wonderful work. Really, thank you from the bottom of our hearts here from Public Health Services Department. We really appreciate all that you do every day. As we close our award ceremony today, I would like to personally thank all of the staff and the community partners who worked together to make this event possible. In fact, those who had a hand in creating this event today, please stand, including my team members here, back there, up there. We appreciate all of your hard work. Thank you. And I would also like to especially recognize the event coordinators, Dasha Dado, Gabriel Faria, Mike Jones, and the planning committee members. They played a pivotal role in presenting this memorable event today. And to the awardees, Congratulations again. Your unwavering commitment to health makes a difference in our local community, and we definitely saw that today. I think we're all inspired to continue to celebrate the power of cultural humility and prevention. Advocate for healthy and fair policies, share strategies for increasing equity, and champion the role of a strong public health system. Yes. We realize that we cannot achieve optimal health and wellness for San Diego residents alone, and that our greatest asset is the partnerships between people and organizations across various sectors in San Diego County, along with county government. By coming together and learning from our cultural differences, we can use our collective impact, power, and knowledge to make the greatest positive impact. And again, thank you for being a part of today's event. It is incredibly special, and we hope you had a wonderful time. We want to ask you to join us, please, for a reception in honor of the awardees. We're just across the hall in room 302. Feel free to take photos, and we look forward to seeing you all in 2025. Thank you again.